Welcome to the Dental ATeam podcast. I'm your host, Kiera Dent, and I have this crazy idea that maybe I could combine a doctor and a team member's perspective because let's face it, dentistry can be a challenging profession with those two perspectives. I've been a dental assistant, treatment coordinator, scheduler, biller, office manager, regional manager, practice owner, and I have a team of traveling consultants where we have traveled to over 165 different offices coaching teams. Yep, we don't just understand you, we are you. Our mission is to positively impact the world of dental, and I believe that this podcast is the greatest way I can help elevate teams, grow VIP experiences, reduce stress, and create A-teams. Welcome to the Dental ATeam podcast. Hello, Dental ATeam listeners. This is Kiera, and you guys, I am excited because you know the one position I have not held in a dental practice, excluding being a dentist, is hygiene. I feel this is my area of it's the unknown. It's the black hole in my world. And so I bring on the most brilliant hygienists to tell you guys tips and tricks and things to make you rock stars. And what's really incredible, these two hygienists actually have their own podcast called A Tale of Two Hygienists. I did meet them at Voices of Dentistry. They were there. We've also done some podcasts together as well. So I'm super jazzed to bring on two of the best in the hygiene world because this is a zone I don't know. So I'm excited to welcome Michelle and Andrew, the co-hosts of A Tale of Two Hygienists. Hygienist, this one's for you. So Michelle and Andrew, welcome to the show today. How are you?
Thank you.
Yeah.
Happy to be here. This is awesome.
For sure. Yeah. Thanks for inviting us.
Of course, you guys. Thank you so much. We, the last podcast we did, Dental ATeam listeners, just know Michelle and Andrew were real nice. I was literally on the side of a road in the middle. I was like sweating because I'm like, this year, 2020.
Whoever said podcasting was glamorous.
It's not glamorous
exactly.
at all. 2020, I have a word. It's living my best life, and the T stands for timely. Timely is not my top trait quite yet. So I was trying to opal mine plus podcast, and Michelle and Andrew were nice enough to podcast with me on the side of the road. They're like super, super snazzy in their studio. Don't worry, I did snap a picture of all of us on Zoom.
Nice.
So we can all see that. So, but Michelle and Andrew, let's talk about hygiene. And I'm super excited to hear from a guy and a female's perspective of hygiene. I think it's fun. Let's just Andrew, I know you had some thoughts and some things to dive into. And Michelle, I know you're the perio guru. So you guys, let's kind of take it away of some of the things hygienists right now are facing, are dealing with that you guys have come up with. And Andrew, we'll start with you.
Oh, man. It's interesting because there are so many topics within the hygiene world that we could cover. Our podcast is all about dental hygiene. But when we take a step back, we've done, Michelle, 300 episodes now or so. And
yeah, it's nuts.
We haven't really covered the same topic twice, really.
Or we've covered the topic, but because it's been over a span of 4+ years, it changes because, our science and our industry is not static, it's evolving. And so you do have to touch on those topics again and just update yourself.
For sure.
Yeah, for sure. And I think that's kind of, one of the messages we want to share with your audience today is how do you stay continually involved in the education process? And how often you need to continue to learn? Because look, we've all taken the same perio course 8,000 times. Or we think that we're sick of taking these perio courses. But Michelle teaches this. She knows how much things are changing all the time. And different people can give you a different perspective. CE is the pinnacle of what Michelle and I are our foundation really is.
Yeah.
It's so true. Yeah.
Go ahead, Michelle. Sorry.
I was just going to add that, CE is 100% the basis of our podcast. It is super important for us to disseminate the newest recommendations or guidelines or evidence-based approaches. But I think one of the things that Andrew and I learned the hard way on the podcast is that nothing is black or white in our industry.
Yeah, you should have heard us in our first episodes. We were bickering.
We argued all the time.
Oh my gosh. Because she's coming from a standpoint of this is what I've seen based on my education. She's East Coast, I'm West Coast. She has different, more perio focused. I do restorative focus. I do pedo. She does geriatrics. We have a completely different viewpoint of where we're coming together on the hygiene spectrum. And man, would we argue.
We argued all the time. And it really, I don't think we do as much anymore, because the one thing that I have 100% taken from this podcast is that there is not one way to skin a cat, as they would say. Like, there's just so much out there. And you do have to hear that one topic, let's say perio, implants, restorative, from multiple different people, because their approach is different. And, Andrew's seeing a very different demographic than I'm seeing. My geography, my social economics, that play a huge part of my clinic, and also my skills and my scope of practice too. I mean, Washington is, and I just did a podcast earlier. Andrew wasn't on that one, but they could do lasers. And I'm like, oh God, South Carolina, like, get it together. Like,
right.
But I mean, granted, I guess I can give infiltration anesthesia. I should just count my lucky stars for that one. But it's so different. And then I think, Andrew, the one thing that we also talk about is how silly the lack of reciprocity is in our country, in our industry. How, for you, I guess, Andrew, like Oregon, Washington, California, kind of close.
I mean, California is actually quite different in obtaining a license. And so when we talk about reciprocity, kind of going back for, the audience members that might not understand what we're talking about, the license that we hold just does not go across state lines. And so what's interesting is I live on almost the most border that you can get between Oregon and Washington. I live on exit 1 of the state. And so jumping across the Columbia River, all of a sudden, I'm not as capable, or I am more capable to do the same things I've been trained on per the state's requirements for licensure. And that's just absurd.
So absurd.
It's why is Michelle, who's so much better at perio than I am, not able to come into Oregon and practice doing perio procedures?
That is a bizarre thing. It's a bizarre thing.
It is.
And it's across the board, like even dentists and different licenses and assistants. And I mean, I remember in California, I got my dental assisting license there. We had to have a dental assistant license, and I could not coronal polish. And then I went to Utah to be a dental assistant, and they were like, "What? You don't know how to coronal polish? Just go in there and coronal polish." And I was like, I am going to be put in jail. I'm not allowed to do this. It was so stressful, and they thought I was like a ridiculous assistant. So what do you recommend for hygienists? What are some things that you guys suggest they do to stay on top of the CE? Or, I mean, obviously you can petition your state boards. I know there are a lot of states that are now doing expanded function dental assistants, which only a few select states were doing. So that is starting to catch wind. But I mean, when we consult in the down south, most of those states, hygienists can't anesthetize. And I'm like, wait, what? You guys can't deliver anesthetic?
Bizarre.
Okay, well,
it's bizarre. It makes me infuriated because I actually gave, I did surgical assisting and hygiene in my very first practice right out of hygiene school, and I actually anesthetized every one of my surgical patients, but I couldn't give a block, which was bonkers. Like, but then I could cross, go over 2 states where apparently teeth and anatomy is different. And
it is. Don't you guys know this? Don't you know this?
Yeah.
I mean,
it's so crazy. I mean, I guess the humans are different there.
I mean, so to answer your question, I have 2 thoughts right away that it's speaking to 2 different types of people. So one is the new grad / younger, maybe in the profession. The problem is, like, we come out of hygiene school thinking, yes, we passed our boards, we know everything there is to know. And so there's a huge knowledge gap in between year 10 and year 1 of your hygiene journey. So CE is really important in bridging that gap and knowing what you're able to do. The other thing that I was thinking a lot about, though, was being prepared for the future with your CE. So, for example, if you can't do laser in your state, what's to stop you from doing laser courses now? And showing the people that are making the rules and the laws that, 1, you're qualified, and 2, you're competent enough to, when they allow that in there, that you'll take it seriously. CE does a lot for you, not just a little check mark so you can renew your license. And if you're looking at through those couple of lenses, I think that's going to put you on the right track.
That's such a good point too, because for the first part of my hygiene career, I definitely just checked off. I have my 14 hours, whatever it is for the year, and I called it a day. I only attended my state meetings. I only attended my local meetings. And where it started for me for this podcast was as I started to travel as an educator, because I do have my master's in education. So I was traveling and going to all these national shows and, implant meetings. And I would sneak in and listen to the speaker. And I was like, wait, what? Why didn't I know this? Like, I've been practicing 10 years. Like, why didn't I know about X, Y, or Z? I've never even heard of this product. Like, oh my gosh, like, what is happening? And that's where we started to meet, and we're like, we have to disseminate this information to everyone, because I get that sometimes you can't travel, you can't go to every national meeting. I almost clocked close to 200 days gone from home last year at all of the meetings. So I not everybody can do that. So let's bring them the information. Because if you're just learning to check off your CE requirements for your licensure, really and truly, ultimately, you're not doing right by your patient. And
absolutely true.
I just feel like that is the one thing that's forgotten, and I try to put it back on like my students, because when I do teach in a hygiene program, I always give it back to them. I'm like, listen, you're a healthcare provider at the end of the day. You're a licensed individual that is going to be maintaining disease or preventing disease. That is we all believe this. It's a huge problem, right? Like perio, decay, like these are things that we need to get under control. If you walked into your pediatric office, take your kid there, and the nurse was just taking CE to check off the boxes, how would that make you feel?
Right. Yeah.
I feel like that's a very, I think it's pretty egregious. I mean, I think it's a big problem in our industry. And so you need to approach CE with the patient in mind, not just also your license, but also the patient, your practice, their needs. So I was seeing a lot of geriatric patients. I was taking a lot of elder care courses. And Andrew sees more I'll be very frank. I am not taking a pediatric course in a minute. I don't want to see those patients. I'm going to pawn those off as much as I possibly can. So I was taking CE based on my patient population.
That's it. I like that idea. And as you were saying that, Michelle, you made me think of the thought of, I said this on your guys' podcast, good always gets in the way of great. And so if we're just checking the box to be a good hygienist or a good dental assistant or a good dentist because this is what we have to do, is that really
making a good paycheck?
Yep. Also that there's all the reasons. But is that making you a great? And I think when we spin our perspective as to why we're doing this, why we're taking the CE, am I just checking the box because that's what I need to do? Or is this something I'm passionate about to become a great hygienist or a great whatever position you're in? I think that lens, going back to you, Andrew, is what then you've got passion. Then you're going to look for things. And also, as you guys were talking, Michelle, when you said, I've been in the industry for 10 years, how did I miss that? I thought, how often do we as human beings forget? I know I've learned things that I have forgotten. And as humans, we just forget. And so that cycle of, yes, you've taken 800 perio classes, take 900 and then 1,000 and then 1,100, because we're humans and we forget and we need that repetition. They say repetition is the mother of all skill. And so by repeating things, that's how we become skilled in our craft, by constantly repeating and learning it. Andrew, I cut you off. What were you going to say?
Oh, no. I mean, I'm glad that you cut me off because that was brilliant. All the things that you were saying. I love it. I was going to say, though, about the way that we consume CE has also changed and evolved a little bit. And I was going to kind of pivot into that point. Because I feel like for a long time that we're tired of going to the same class over and over again. We're tired of going to our local meeting who's going to have the same 4 speakers because we can't afford to, quote, import people to come speak to us.
Sure.
And so, or we can't, like what Michelle said earlier, we can't afford to travel to go to places. And so one thing, I mean, we have this for the podcast, but I know other podcasts do it, but consuming your CE through different media like webinars and podcasting is great because then you get to pick your particular speaker, you get to pick your topic, you get to pick so much more than just kind of settling for what's local to you or what's being just kind of pushed on you.
Mm-hmm. That's a great point. And I think that comes down to mindset, because all of a sudden I could hear like, but I don't learn online. Well, guess what? The nation just switched to learning online.
Right.
So,
100%.
I think
Right.
that's also a mentality too, right? Do you want to learn online? Can you learn? How can you make this a reality? And I think it's brilliant because I remember my husband, he's been reading The Richest... I think maybe it's Good to Great. Maybe it's Rich Dad, Poor Dad. I don't remember. It's one of those cool books. I can't remember which one. He's been in a lot of them lately. And it said that more gold is mined from the mines of men than anywhere else. And I really have loved that because we're so often chasing these different wins, if you will. We're looking for the miracle of how to have a diet, and we're looking for ways to increase our skills. We're looking for CE. And the reality is there's so much gold in the minds of all these people around us. And we are so freaking lucky to have podcasts and webinars and the internet that can literally hand deliver. And then I think it's more just sifting and not being lazy. I'm going to be real bold today.
Yeah.
And being intentional on it to make sure that we really are going after what's truly best for us in the space we are. And Michelle, I do love how you said based on your population base, because I think people also can get information overload. And how do I like stop being a CE junkie? And I'm learning to implement, not just learning to glean all this information. But I really do love the parameter you gave of what's going to benefit my patient base right now, or Andrew, to your point, what's going to help my future me become an even better hygienist, even if I can't do it now. Well, I'm going to start learning about this so when it's passed, or I can help the influential people
implement it. Yeah.
Totally.
Right.
All right, Dental ATeam family, you've been waiting patiently. I've teased this out and I'm ready to reveal it. Get ready for our 12 Systems Comprehensive Success Cycle. Yep, I'm so excited about this. We're going to be offering Dental ATeam Silver, Dental ATeam Gold, and Dental ATeam Platinum membership to get you guys into the success cycle with us. So hop on over to our website, thedentalateam.com, where you guys can pre-register. That's right. For the month of June, we are going to be doing 50% off of your first month. And we're limiting it to only the first 30 offices who sign up. So pop on over, check it out, Dental ATeam Silver, Gold, and Platinum. I can't wait to see what office you are. Join us this month only. We're releasing this July 1st. So pop on over, get pre-registered, 50% off your first month, thedentalateam.com. Decide what office you want to be, Dental ATeam Silver, Dental ATeam Gold, or Dental ATeam Platinum. Can't wait to see you there.
Do you mind if I counterpoint Michelle's point real quick?
Of course. Do whatever you want. This is our podcast, guys.
As per usual. No, it's not necessarily that. So the patient-based thing is absolutely spot on. The only thing that I have an issue with on that is that, Michelle, when did you start doing assessments for airway? Did you know that your patients had an issue before you started learning about that?
No.
Right. So there is a thing with CE that I think that even if you're not taking the CE that's right for your patient base, you should be taking it anyways because it might actually be right for your patient base. You might not know it.
Maybe that is maybe taking it. I need to clarify then, because for me, seeing an elderly population, well, I'd say all people now have airway issues. So
no, you're right. You're right on both of those things, though.
Yeah,
I wasn't trying to counterpoint, but just adding.
No, but that's a good point to bring up. And I would also even bring up the fact that your last hands-on training should not be what you learned in school.
Oh my gosh.
Good point.
Great point. Holy crap. Yes.
Like if the last time that you took a course on about hand scaling, ultrasonic, airflow, lasers, any of that as a hygienist, because I know I see this a lot when I go to these courses and it's offered to dentists and it's offered to surgeons. It's, they're talking about these big sexy procedures that we got to learn. Yeah, I've even seen Botox hands-on. I don't see a lot of scaling. I don't see a lot of things around air, like the future of biofilm management, or even I'd say home care, because I think that needs to be hands-on too. But don't let that last course be what you took in school, because And I think there's a level of shame around it. Like if you go take a hands-on course, you're admitting that you're not a great scaler. And the shame that comes along with that as a hygienist is it's heavy and it shouldn't be that way.
So
that's a good point.
I'm going to play... I'm not a hygienist, guys. I don't know what this world is like. So as I'm listening to this, I'm thinking, okay, of course, me being the person I am that loves systems, I would say, okay, guys, like, is there a checklist or are there certain CE buckets that, or would you suggest like maybe I have my like advanced something I don't know about? Maybe I go back to hand skills. Like, are there buckets that people could start looking for CE? So it makes it, because I'm always trying to think like, how do I simplify this to make sure I'm well-rounded? Are there 4 areas of hygiene to be looking in? Do you guys have any thoughts on that? Because I'm always trying to think, how can I remember this without having to go back and listen to this podcast of what type of CE to take?
Gosh, that's a hard question because it's individualized per all of the things we talked about already. But to start off, I would say, are you an audio learner, visual learner, or are you a hands-on learner?
Okay.
And I would start or a reading learner, because I think that we all learn at different paces in different ways. And that's where I would first start. And then as you're starting to search through and sift through all of those things, honestly, even though I gave Michelle a bad time, I would start on the things that I'm seeing in my practice and how can I get better at that? This is going to be kind of, I'm going to say
it.
I'm going to go, I'm going to say hand scaling is one of the last things that you probably really need to be taking, because I feel like we put so much emphasis on that one small little sliver of, I know it occupies a lot of the time that we're doing things, but really
the grand scheme of things, it's not 100%.
Really doing too much. There's so many other tools within
to get people healthy.
Yeah. And we're missing all that emphasis.
Well, I think that would just be like checking the box, right? Like, well, I'm going to take this for hand scaling, but that also feels like comfort zone. Again, I'm not a hygienist, but I would imagine your hand skills are probably something you learned good enough. Again, I'm like walking on ice that I don't
you're
know.
not hurting people.
I don't know this at all.
Generally, you're not hurting people,
yeah.
I would just
you might
imagine.
not be helping people, but you're probably not hurting people.
Okay, yeah. All right. Well, maybe but I don't know, like, how do you know if your hand skills are good or not? This is a genuine question. How do you know?
Well,
I would say it's from your patients.
Yeah.
You do evaluations back on like the tissues, the all of the objective measurements of bone levels, soft tissue measurements, and all of those things, gingivitis scores, things like that.
Okay.
That's going to tell you if what you're doing is actually being helpful. Radiographically, if you're still seeing the same calculus, you're missing. You are so missing.
Something wrong
to reassess. Yeah.
So, okay. So if I've got that clear, my patients are great, then I need to move on to other CE that's actually going to move the ball forward? Or?
Yes, serve you. So the one thing that Canada does that I really love is that they have a portfolio and they create goals for their year, right? Andrew, am I correct in that?
Is it every 5 years?
Is it every 5?
It's something. It's Canada.
It should be every year, but okay. Well, if I think if you're looking for a process, like every year, what's your goal? Is your goal to implement lasers? Is it airway? Is it like the oral systemic? If that is like, look at the goal, I guess. And for me, again, I'm going to look at my patient population. What are my needs? Because I'm not going to go, veg out of implants if I'm seeing an implant one a month, So am I going to need to look at, what Andrew said, like the oral systemic, and are my patients getting healthier? Or am I being told by my doc and via radiographs that I am missing some calculus every now and again, and so frequently that I might need to go and get some more courses? So I would be like setting a goal for me personally and for the practice and the practice's needs, and then go check those boxes then.
I like that.
Also, going back to Kiera, what you're always talking about, though, I think the team approach is really important. If you are not sure about what you need to study, ask. Ask your doctor, ask your manager, ask your leadership team, ask all of those people. Like, look, I feel like I'm doing pretty good, but where would you like to see me invest my time and efforts into?
That's super good point, because, and I love that you guys are hygienists. And I mean, I don't know, so I would like you to answer this question. I would imagine, and I'm going to guess, so I'd love you to confirm or deny. I would guess though, you want your doctor's feedback. So like, hey doc, like where am I dropping the ball? Where could I improve? Where could I be a better
Andrew
asset?
might not.
Michelle says yes, Andrew. Because I would guess that I would want to hear from my doctor. Obviously, docs do it in, like, we've talked about word ninjaing, like word ninja that stuff up. Make them feel like $1 million bucks. But I also think hygienists, be okay. And I'm going to speak to them because I think so often hygienists, because there are licenses from what I've seen, that you feel this expectation to be great and that you can't make mistakes and that you have to be a certain way. And I'm going to say, I don't think you have to be that way. And I think if you're humble and you're willing to take advice, you can be so much better. But Andrew, what's your take on that?
Okay. My situation is a little bit different, I think, than most people's. I think that if you have a trusting, loving relationship with your doctor, I'm not saying I don't, clarify that real quick. But if you have that relationship already with your doc and your leadership team, yes, you're right. You're absolutely right that you should be open to that kind of feedback. All too often, though, I've worked with new grads who don't really necessarily know the things. However, clinically, if they can see consistently that you're missing, and this actually happened to me with one of my docs, for whatever reasons, the distal of 18.
It's a beast.
And it wasn't even calculus. It was just soft plaque. I wasn't removing it adequately, consistently.
Oh yeah, that's unacceptable.
Some of the occlusal grooves, wasn't focusing on the occlusal as much as I should have been in a lot of cases. And so, little things like that, clinically, I love that kind of feedback on. But I think that I'm an overachiever and I like to take lots and lots and lots of courses. So I know quite a bit. But yes, I think that in the big grand scheme of things, you should always be working with your leadership team.
Totally agree. And as you guys said that, I was thinking, what are the company goals for the year? Where does the office want to go? And then look to see what CE could actually aid in that, so you can be an asset. I just did a podcast the other day where I said, team members, you need to become a necessity in your practice. So I think learning how to be a necessity and making sure that you're not just there because, they need me, but how are you being a necessity truly? I think taking CE courses or being, hey, doc, so-and-so, I heard on this awesome podcast, to tell it to hygienists, that they do XYZ. And I researched it and I think we could implement it. What are your thoughts? That to me is the dreamy McDreamy team member, because you took the initiative, you went for it, you heard, you were educating yourself, you went and found information that could really aid the practice in the direction they were wanting to go. And you just became a necessity to that practice. So that's also, I think, a way to guide on this CE topic.
For sure.
Well, and you mentioned on our podcast about how great communication, right? And how important it is to, one, have respect and value, but also good communication. And I've had it both ways where I've worked for a dentist where they would be in their perio journal and be like, I think this would be something Michelle would like to learn, and pull it out, send it over. Let's talk about this. Do you think this would be good for our patient care? But I've also had the opposite where they've ripped it out and posted it on my locker. I'm like, why didn't you know this? And I'm like, you can slow your roll. The last 3 crowns had a margin. So let's take a minute. Okay. If we're going to be telling people how to do their job. Yes. But there's also that good communication of and I've always worked in perio. So from a surgical standpoint, I'm struggling on this non-surgical. I don't know what I can't. The calculus is winning. I don't know what to do. And they've come in, but I don't know. This might have to be one of those moments of we're flapping it back. And then they've called me in we've flapped it. I'm going to come do the exam on your patient and you're going to come in here and sit down for that. Totally. And that kind of collaboration and partnership. Oh my gosh. That's a beautiful thing to work in that environment. Oh, I could feed off of that. That's sustenance for me as a clinician.
Totally.
I think you nailed it though, Michelle, too. There's also CE on communication. There's also CE on business. There's also all these CEs that are not necessarily clinically based, the soft skills, if you will, that are also important. So don't overlook those ones either if you're searching for good CE.
Solid. That's a really, really good point. Michelle, I want to piggyback on what you were saying of docs if you just heard what Michelle said, use your hygienist as your ally and your friend versus the enemy. I think so often we want to pick each other apart because we want to grow each other. I think there's a time and a place, and it's not in front of a patient ever.
Please don't.
to boost each other. I think when you have your hygienist on your team and they're looking out for you. I can't tell you how many hygienists have covered doctors' bouteilles because they've caught something that didn't seat correctly. They've caught an open margin. They've caught decay that you didn't see. And vice versa. I think doctors can catch when you miss some calculus
100%.
and when you've missed a sealant or you've missed an area. And I think it's really one of those things, like you said, Michelle, I think it's important to really get a good relationship with the hygienist and the doctor to where you do have that open communication. And hygienists, I think if your doctor's maybe not as open, to me, one of the easiest first steps, as hard as this step is to ask them for their help on something you don't know, because all of a sudden you become human. Like, hey doc, I like you said, Michelle, I'm struggling to get, like, the calculus is getting the best of me. What are your thoughts? What are your tips? I would love your help if they're not open to calibration or collaboration at the beginning. Because when you become human and you admit that you don't know everything and you want their help, they're more likely to be that way. Or if you cover their back and be like, hey, just want to let you know, caught this margin. I don't want the patient to know. I've got your back 110%, whatever you want me to say, I've got you. That then starts to build that trust back and forth. And I think you guys can then really work more in tandem versus against. And I see some dentists and hygienists not working in tandem. And I feel, hey docs, I think, Andrew and Michelle, give me your side. I think hygienists want to rally and advocate for their doctors, and they want to be that trusted person in their world if the doctors will allow them to do so.
For sure. I feel like it's my job to make my doctors look good. And so whatever that really means, if that means I'm getting, I'm doing my portion of the overall patient care and keeping them healthy from a perio standpoint, or I'm placing restorations or whatever, doing the very best job I can for the doctor for that point, from a production standpoint, from a trying to keep the patient in our practice standpoint, whatever that looks like, it really is all about making my doctor look good and using those key words of being like, hey, Dr. So-and-so is really amazing at this particular thing, and finding those good things to say about them. I think that's just part of our job. Yeah.
So docs, get your hygienist to be on your side. Michelle, what were you going to say?
Yeah. Well, I don't know how much time we have.
You're good.
So there's a model that Tracy Butler has taught me. She's worked for Straumann. She's been like a speaking mentor for me for many years. And it's called the high performance team model. And in that model is like communication, defining roles and responsibilities, but also transparency and trust. And I think when you have all of those things in place, you want to be there for your practice, for your team, for your doc. Like I'd take one for the team if it was for the team, because I know that would be done for me, right? It comes or it gets to a place where, and I think I've experienced this more than Andrew has, which has made me very jaded and something that I've had to work through and grow from, because I've gotten pretty bitter about it in the dental industry, because I'm at 20 years this year. Actually last month marked 20 years.
Well, happy 20 years.
Thank you. That snuck up on me. But, things like I'm busting my butt. I'm working all kinds of hours. I'm working so hard to get our patients healthy. I haven't gotten new instruments. I haven't gotten a raise. You're telling me that I need to slow down on my glove use. And then, oh, by the way, you're going to Thailand for Christmas. Like, I can't, like, that kind of environment it will crush a strong, motivated teamworker's soul. I don't know. Andrew maybe would disagree on this, but I feel like for some,
my doctors have all been gems, so I don't know what you're talking about.
I know.
Michelle, how would it be more empowering? Because obviously some of those things need to be discussed. How does it come across better to you specifically? So it is more empowering, because I know a lot of doctors struggle. So they're just like, I just don't want to talk about it because I don't want it to be awkward, but then it eats at them. Then there's the resentment. Then all of a sudden there's a huge blow up over the gloves when it's probably not even the gloves. It's something else. Right. But it's those freaking gloves.
I feel like the gloves, like You're stepping over dollars to pick up dimes. Isn't that
Slow
like
your
whatever
roll.
that saying is?
Just-
like you're stepping over major money to pick up those pennies that you're saving with glove use. I think when you're not talking about God, and I can't believe I'm saying this, Andrew, because I don't love business, but when you aren't talking about the goals and the production and being transparent, but also valuing my position. Like, again, if I'm using the scaler that I brought with me from hygiene school, like that's not okay.
Sure.
And then when I do come over and say, and I will say this is also on the hygienist too. Like if you're just showing up asking for raises, but not trying to find ways to bring value and more production to the practice, that's a problem. But if I am really busting my butt and really trying to add value and I can't get a raise from you, you're giving me crap about cutting patient bibs in half, because I've gotten that too.
Wow,
and then
that's a first.
And then you're going on vacations or we're redoing something in the office. I'm like, I'm a clinician too, and I literally am dying over here. I'm dying.
Got it. Well, I think
I don't know.
I think that's because I have a lot of hygienists, and you're going to hear the doctor side and the team side, and like it volleys. So like hygienists, high five. Let's get you new instruments. And I like to set like, hey, to get new instruments, this is what we need. And I had one group, they wanted new chairs.
Exactly.
So I'm like, fine. The doctor wanted them to get out on time to like lower payroll, because the hygienists were taking like 45 minutes to an hour after the end of the patient, which I don't know how that happens. I was real speedy on my notes, but hey, everybody does their thing. It doesn't matter. And I was like, fine, if people want to get their instruments or you want that, like make that compromise between the two zones of that transparency, like beautiful. So every day that everybody's out of here, like what's realistic 30 minutes after our last patient, if everyone's out of here, we're going to deposit like $100 into our instrument fund, and we need X amount of dollars for this fund. And then when it's there, and then doctors, you can move money. I've done this several times, but I think that that's the transparency piece. Like I hate saying no.
Yeah.
I hate saying yes. I like it to be like, fantastic. That's what you want. Let's find the way to get there, and let's build
100%.
it so you feel. Same thing with a raise. You want a raise? Awesome. Well, this is what your base job is. If you want to get a raise, this is what we're looking for. So people know what they need to do to get what they want out of life. That's that transparency on the same team piece. And I love hearing from both of you your perspectives, because like this is real talk. This is hey, that crushes my soul. This CE is not jamming and jiving. Like I didn't know going for a CE for hand skills was a walk of shame. I had no idea. I figured like, yeah, I don't know how to do this, so I'm just going to do it.
I'm going to name a course the walk of shame. That is exactly the truth though. It is. Yeah. It feels like the walk of shame. Like if I dare sign up for a course, or if I say I'm struggling with the distal of 18, it's and especially if you're in an office with multiple hygienists and maybe you're the new kid on the block, it's a little soul crushing, and there's a lot of like mean girl mentality.
I feel like that could happen. So as a recap on all this, you guys shared so many things. I think my takeaway today was huge on CE, how to do the CE, how to get the team, like where to go, what to look for. Andrew, I love what you said of figuring out how I learn best, and then finding CE that supports that, and remembering we're all going to do it. Michelle, I love that you said it can feel like the walk of shame. Reality is you got to just do your walk of shame, and it's okay. And I think when you own that, you also have the courage to allow other people to do it as well. They said that courage is not the absence of fear. Courage is fear walking. And so really, truly, it's going to be a little scary. And then I think my like last takeaway of all this was docs and teams and hygienists get on each other's team, be open, have that transparency, support one another. I also think it's important, doctors, this might be a humility piece, and hygienists, same, whichever side wants to do it, but go in and ask the doctor, the hygienist, like, hey, I want to make sure you feel totally supported by me. What can I do to show up and support you that would mean the world to you? And find out for each of them, and then act on that, because I think that starts rolling that ball of hygiene, of that communication, of the transparency. Those are my takeaways. Andrew, any last thoughts or things you would want to add into this today?
No, I think we covered a really good amount of things. And I guess my only thing is, if you need to replay this particular podcast to listen to it again, I really highly encourage you to do that, because that is one thing that our listeners have given us feedback about, is that they've re-listened to the podcast over and over again, so that it actually sinks in. And so if that works for your listeners, that'd be awesome too.
Oh, that's such a good point. Thank you for that. Michelle, what about for you?
One of the things that I've learned on this journey in the last 5 years is to have better communication and also define my expectations and speak openly and clearly, and let go of some of the unfortunate things that I have experienced with previous dentists and team members, because there are some real gems out there. I'm so happy that I found them, but I will say I've also have this like a knee-jerk reaction of that, like that muscle memory is there of like, they're going to take advantage of me. Like I'm working my fingers to the bone, but just have that good communication. Be open to feedback and good criticism. I don't know. I guess that's it feels like an oxymoron, moron sometimes, that good criticism, but it's there to help you grow. And if you aren't uncomfortable, I don't always believe you're growing. So be okay with getting uncomfortable and embrace that cognitive dissonance, that ickiness that sometimes comes along with growth and learning new things, because dentistry and dental hygiene is not stagnant. It's evolving. And if you're still practicing with the same beliefs that you graduated with, you're truly doing a disservice, not only to your patients, but to yourself, because you could be happier and less frustrated if you could just get past some of those old belief biases.
Oh, so well said. Thank you guys. Andrew, Michelle, it's tricky to get you guys coordinated on schedules, East Coast, West Coast. We've done this twice now. But I really love what you brought, and I'd love to have you guys back on another time to just share more of, because this is a zone that's not my zone of excellence. I don't claim to be a hygienist or to understand. And I think both of you bring such a beautiful dynamic. So you guys, if you loved Andrew and Michelle, pop on over. They've got A Tale of Two Hygienists as their podcast. They also have a fantastic newsletter. So be sure, and you guys can help them get to their goal of 10,000 Instagram followers as well. We both Dental ATeam and A Tale of Two Hygienists, we have this like cool thing, because you guys, you can do a swipe up. We're going to do so many fun things with the swipe up option.
I want to swipe so bad.
So go help them out. I think they've got some really fantastic information. They break it down. So you guys pop on over. Michelle, Andrew, any other ways to contact you beyond the podcast that would be beneficial if they want more info from you guys?
I think you can both find us both at ataleoftwohygienist.com. And then we are Andrew at ataleoftwohygienist.com or Michelle at ataleoftwohygienist.com.
Awesome. Well, you guys, thank you. Thanks for being on the podcast. Thanks for joining.
Thank you so much for letting us be on.
Yes,
of course.
Yes,
this is great.
I love it. All right, you guys, thank you so much for joining, and I'll catch you next time on the Dental ATeam podcast.
And that wraps it up for another episode of the Dental ATeam podcast. Thank you so much for listening, and we'll talk to you next time.